If you were to receive a letter that said to come in for a cancer screening, how would that make you feel?
Oh, I don't know. Have to process all of that.
I won't feel so nervous now because I've already had one.
I feel scared because in case I find out that I had got cancer.
Upsetting.
Scared, nervous.
Just go and see what will happen. You don't know what will happen unless you actually do it.
Cancer screening is an important part of cancer prevention. If we can catch cancer early, then it means that treatment is more likely to work and more people survive.
People with learning disabilities are not as likely to be screened, so we need you to work with us to improve these numbers. Uptake of preventive services such as screening is low among people with learning disabilities.
There's all different types of cancer around the body.
Cancer is a illness or a disease that can affect any race or nationality or any age or gender.
I think cancer is like a disease.
Cancer is a reverse engineering of somebody's biological beings. So instead of us growing positive things, it absorbs those positive things and creates like a black hole within inside a human being. And then that spreads and grows and grows. So it's like a vacuum.
Disease that could kill you.
What people have and cancer kills you.
You hear cancer. I know many people that have died of cancer. My mother passed away with cancer. It was so quick. So to me, it's a really scary. You hear the word cancer and you think, oh my goodness, it's like doom.
Cancer has to do with our cells. Cells are small units that make up living things, including our bodies. Our cells grow and divide, and when they don't do this normally, they turn into cancer.
Well, biblically we'll say bosoms.
Boobs, breasts if I'm in a GP.
Okay then, melons.
Bosom.
Boobs.
Breasts, boobs, boobies.
Tits.
Just boobs and tits.
Vagina.
Vaginal room.
Vagina.
Oh, there was a friend who used to call it a nunny.
Bottom, bum, arse.
Posterior.
Well, in Yiddish we call it tuchus.
Butt.
Arse.
No matter what you call them, they can all be affected by cancer. We're going to talk about 3 different types of cancer: breast, bowel and cervix. Every part of the body can be affected by cancer, but each has different symptoms.
It could be you're tired.
Maybe if I get blood in my bowel.
Might have headaches quite a lot.
A level of tiredness and weakness is something that I know of.
For moles, it's discoloration, and if it's got bigger or smaller.
I think lung cancer, if you cough a lot.
The difference to your bowel movements.
If I find any lumps on my body, could be a sign of cancer.
First we look at bowel cancer. You could have blood from your bottom and or blood in your poo, change in your bowel habits that less you can explain, weight loss that you don't know why, extreme tiredness for no obvious reasons, a pain or lump in your tummy.
Then there's breast cancer. A new lump of area of thickened tissue in either breast that was not there before. A change in the size or shape of one or both breasts. A discharge of fluid from nipples a lump of swelling in either of your armpit, dimpling on the skin of your breast, a rash on or around your nipple, a change in the appearance of your nipple, such as becoming sunken into your breast.
Finally, cervical cancer is tricky as it often has no symptoms in its early stages. If you do have symptoms, the most common is a normal vaginal bleeding, which can occur during or after sex, in between periods, or new bleeding after you've been through the menopause.
So now we know what cancer is and some of the symptoms to watch out for, but how do we find cancer? That's where screenings come in. Again, each one is different for each cancer. Screenings are offered for people who are asymptomatic.
Asymptomatic is when people don't have any symptoms, but their age or gender means they could have cancer without knowing, so screenings will detect this.
Bowel cancer screening is offered to people aged, if you are 60 to 74, you'll automatically be invited to do a home test kit every 2 years. If you are 75 and over, you can ask for a home testing kit every 2 years by calling the cancer screening helpline on 0800 707 6060.
Breast cancer screening is offered to all women aged from 50 to their 71st birthday who are registered with the GP are automatically invited for breast cancer screening every 3 years.
Cervical cancer screening is offered to all women and people with a cervix aged 25 to 64 should be invited by letter to their GP.
If you go for a mammogram, you will attend a hospital unit. If you have an at-home bowel screening test, that will take place using the male, and for cervical screening it will take place at your local surgery.
Let's look at the process of the screening.
I had bowel cancer about a while back.
What did you notice was happening?
Change in my body.
A change. What was that change?
In some ways, just going lower. Not normal.
So it didn't look normal to what you normally see your tummy as?
We were talking about it at the doctor's, and I decided to have a mammogram because I've never had a screening before, and I was a bit frightened, but I thought, oh, I'll go for it. But when I had the results, it came back all clear.
As a carer, you would probably book the appointment for your client, and the clinic might not always know your client's needs. You need to make sure to mention these so that the clinic can make appropriate adjustments to the appointment to suit your client's needs. Such adjustments can be making sure there is wheelchair access in the practice, providing easy read appointment letters, giving someone a preferred appointment slot if they find it difficult waiting in their GP surgery or hospital, later or earlier appointments. Priority patients, getting appointments and having access to on the day urgent or emergency appointments, even if their condition does not necessarily require on the day access. Longer appointments if someone needs more time with a doctor or nurse to make sure they understand the information they are given. Information in easy read before and after the appointment, easy read on fast track referrals and cervical screenings, etc. being able to bring in their carer or support worker. It's also good practice to sit down with your client and to write down any symptoms they may have been experiencing so that you can bring that with you to the appointment. Bowel screening is a poo test which is done at home and through the post. You will receive a test kit, a letter, a free post envelope, and instructions of how to complete the test.
The bowel screening kit is a test which is given to people when they reach their screening age.
The test is really easy to do yourself. To do the test, you need to collect a small amount of your poo. You need to make sure you wash your hands before and after the test. To catch your poo, you can use toilet paper lining a clean, empty container that you can balance in the loo. The container has to be big enough not to disappear down the toilet. Or you can hold it under your bottom while you do a poo. Once you've done the poo, take out the container and immediately test it with the testing kit. If you look at your test kit that arrived in the post, you will see a container with a green top. You need to twist and pull off the green top. You must make sure that you don't by accident upturn the clear tube so that the water falls out. And you will see that the top is attached to a green little stick. Do not stick the poo sampler vertically into the poo, but pull it along nearly horizontally. Then take the green top with green stick attached and put it back inside the clear plastic part of the test kit and push it close until you hear a loud click. Then you need to label the test kit with your name and date of birth. Once you've done all of those things, then throw the poo into the toilet and throw the container straight into the bin. Once you've done all of that, put the kit into the free post envelope and peel the tape off from the top of the envelope so that you can stick the top of the envelope down firmly. You don't need a stamp, you just need to post it in the post box. You should get a letter from the NHS screening programme within 14 days giving you your results. If any blood is found in your poo, then the screening centre will contact you to arrange some more tests. A doctor or a nurse will talk to you about what they found and the tests that they plan to arrange for you. If you have any questions or problems, you can ring 0800 707 6060.
I had a kit like an envelope, came through the post. I did a poo in the toilet with a stick. Take poo from the poo on a stick and folded the envelope and sent it off. I didn't do it. Piece of cake.
Well, we had to check in with somebody and say, oh, I've just come for a mammogram. And then we saw the lady in there, and then she said to us, well, I've got to get undressed, take my bra and blouse off. And then she took me into the room, and then she did the mammogram. Took one of my breasts in the machine first, and then I squeezed it a little bit. Then I did the other one in the machine. I was a bit frightened when I was going in there, but I was all right.
The process for breast cancer screening is different. Let's hear Dr. Nero explain that process.
This test can find changes in your breasts that are too small to see or feel and to detect breast cancer. On the day of your test, you'll be asked to attend your local breast screening unit, which is usually located in a hospital or mobile unit. You can take a carer or a friend along with you if you like. On your arrival, you'll be checked by the staff and they can help you to get ready for the test. A female health practitioner will then perform the X-rays called mammogram. The test involves scanning each breast one at a time. The machine will flatten your breast and hold it in place. You'll need to keep still just for a few seconds while the x-rays are being taken. Usually 2 images of each breast are taken. The test itself should not be painful, but may be a bit uncomfortable. After you've been x-rayed, the mammogram will be checked for any abnormalities, and the results of the mammogram will be sent to you and your GP within 2 weeks of your appointment.
This process is different for cervical cancer though. Let's hear Dr. Nero explain a cervical smear.
This is a test to check for any abnormalities in the neck of your womb. This happens at your GP surgery, usually by a female practitioner, such as a practice nurse. On the day of your appointment, usually the nurse or GP will go through the procedure with you and answer any questions you may have. The nurse will then ask you to go behind the curtains to undress waist down, and she'll give you a sheet to cover yourself. You will then be asked to lie on the couch with your ankles together and knees apart. The nurse or GP will then insert a speculum, which looks like this. She will use some lubrication and insert it into your vagina. This is then opened up so your cervix can be seen. A soft brush is then used to brush away some cells and then sent for further testing. It only takes a few minutes. Once you've had your test done, you'll be able to go home, and within 2 weeks of your appointment, you'll get your results.
Say one of your friends said, "Oh Tommy, I got a letter and I need to go and have a cancer screening test." What would you say about it?
Go and try it.
Yeah. Why should they try it?
Because they'd be better off.
I'm really happy that I wasn't going to go. I thought, oh no, I don't really want that. And then I thought, oh, I'll give it a go. So I did it.
Just be relaxed, calm down, and go through it.
Cancer screening is very important. Screening tests are designed to pick up cancer when you do not show any symptoms. Cancer testing saves thousands of lives each year. We know when cancers are found early, they're much easier to treat, and the treatment is much more likely to be successful. Remember, it is your choice to have the test or not. But there are more good points than bad points about screening on the NHS, so we would highly recommend that you have the test. Sometimes words such as cancer or screening can make you worry or may make you feel scared. But remember not to be afraid or embarrassed to ask any questions. Feel free to speak to your relative or carer, or your nurse, or even your GP, who will be able to answer any questions you have and give you any information that you need to allow you to make a decision.
I hope this video has explained to you the process of cancer screening and its importance. We can all work to prevent, detect, and treat cancer early by taking part in these screenings and being aware of cancer symptoms. If you would like further information, please visit www.nhs.uk/conditions/NHS screening/ or speak with your GP.